Hello, everyone. Happy Tuesday, and welcome to our final session of Public Health Plus Season 2. My name is Michelle James, as Diego mentioned, and I am the Senior Director of Alumni Engagement here at the Rollins School of Public Health at Emory University in Atlanta, Georgia. Today, we're exploring the intersection of public health and the care economy. Before we begin, I just want to let you know our Public Health Plus series was created by the Rollins School of Public Health Alumni Board Career Development Committee in partnership with our very good friends at Orange Sparkleball to really examine the spaces where public health intersects with other disciplines, discuss that work, and then hopefully broaden our thinking. Throughout the series, we've been talking with experts from across a variety of industries and exploring how to successfully break down silos in order to reimagine a more holistic and multidisciplinary approach to public health. The industry of care is a complex one, and it has touched nearly everyone's life. It is a crucial cornerstone of our society, yet it remains incredibly invisible and underappreciated. We are now facing a looming care crisis, from childhood to elderly care and everything in between. So how do we begin to address this multifaceted challenge to improve the lives of those both providing and receiving care? Today, we'll talk with Sarah Gardner and Megan Kluth and discuss this question more. With Sophie Becker, we'll explore the intersection of public health and the care economy. So let's meet today's hosts and speakers. Sophie Becker is a design strategist who joined Orange Sparkleball after being a design apprentice at their sister organization, SparkCore. Since joining the team, she's focused on strategy and communications projects for both community networks and public health issues. All of this has strengthened her human-centric design and innovative strategy skill sets. She continues to increase her interest in how design, innovation, and public health can all work together to solve large, abstract problems. Sarah Gardner is an assistant director with the KU Center for Public Partnerships and Research. Her portfolio at KU CPPR centers around Kansas early childhood initiatives and broader systems change work. She is the project lead for the KU CPPR on the Kansas Preschool Development B5 Renewal Grant, serving as the state's overall project coordinator for the grant and supporting different governance groups. Prior to joining KU, Sarah worked for 10 years in development with child welfare, housing, and health-related nonprofits in the Kansas City metro area. Megan Kluth is a research project coordinator with the University of Kansas Center for Public Partnerships and Research also. There, she works to strengthen the systems that serve young children and their families. Megan's passion for increasing accessibility, affordability, and equity of caregiving resources stems from her own personal experience with a chronic illness. Prior to joining KU, Megan led the Colorado Respite Care Program, a statewide program that provides supports for caregivers across the lifespan. Ladies, thank you so much for being with us today. I'm very much looking forward to this conversation. Sophie, I'll hand it over to you.
Thank you, Michelle. I see a lot of familiar faces in the crowd and some new ones, so thank you all for being here. And Sarah and Megan, I'm so excited to have this conversation. I know we've talked about a lot of these concepts many times before. I'm excited to dive in a little more in depth, hopefully today. So to kick us off, I just want to make sure we're all aligned that when we say the word care economy, we all know what we're talking about. So could you define it for us, please?
Of course, and thank you so much to Sophie and Michelle for having us. We're really excited to have this conversation as well. So I'm going to start by explaining the care economy with a quote that I really love from former First Lady Rosalynn Carter. And she said, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." And that is a quote that I've used throughout my career, and I really believe it's true. I think caregiving is something that impacts us in some way, almost all of us at some point in our lives. And when you look at care roles and care needs across the lifespan, it really represents a significant portion of the population in the United States and really across the world. It's just a very relatable issue. And so the care economy it represents these individuals, whether they're caring for a child or an older adult or somebody with a chronic disease or a mental health challenge, represents these people providing care as well as receiving care, and all of the professionals that may touch their lives. They may provide healthcare, household management, financial, legal support. And when you add all that up, the impact is significant. In fact, the national economic impact of these care needs across the lifespan is an estimated $648 billion, which is not a small amount of money. And I think when I think about the care economy, I think about how it's a core pillar of our national economy. And I think the pandemic really highlighted that, but it's something that for as many people as it touches, we still don't talk about it enough. And so I'm very excited to have this conversation today, because not only is the need great, I think the opportunities are pretty incredible. And I'm excited about that. I think, in fact, there are several jobs within the care economy that represent some of the fastest growing positions in the US. So there are plenty of opportunities for people to think about how they want to get involved with the care economy. And I'm excited to talk about that today.
Awesome, thank you. That's not a small chunk of change. So how did both of you, Sarah and Megan, how did you get involved in this? What sparked your interest in caregiving in general?
I can start. So I think my curiosity about this, came from a young age. I watched both my parents, who were only children, care for their parents, my grandparents, as I grew up, and I saw some of the ups and downs of that process. And then as I got older, I didn't really realize that kind of helped lead me to my career path. But ultimately, what changed for me was when I was in college, I was diagnosed with a chronic disease, and it changed my life overnight. And I have been extremely fortunate to have the support system and access to resources, and it's still been challenging to navigate. I think it was definitely a shock to see how difficult it is to navigate our healthcare system and the caregiving process, and just the toll that any sort of health challenge that really none of us are prepared for can take on an individual and in a family. And so that experience really led to my passion for advocating for caregivers and finding ways to help people feel less alone when they're navigating those challenges.
Thanks, Sophie, for having us. I'd echo all of what Megan said. And I think my lens, or the way I come at this, is a little bit more from sort of the economic standpoint and some of the equity issues underlying the care economy and the opportunity there. Grew up in a very rural community with all of the traditional sort of rural stereotypes that you might think of surrounding me. And moving into more urban areas, there's just vast differences, and they're very stark. And it really sort of highlights some of the equity issues. And then early in my career, as you mentioned, or as Michelle mentioned in the intro, I was a fundraiser for a long time. And I fundraised specifically for an organization that was providing housing to adults with severe mental illness, chronic substance abuse, and HIV and AIDS. And the focus that we had around fundraising, hundreds of dollars, not even millions of dollars, but hundreds of dollars to provide basic dignity for people who really through no fault of their own, and that is irregardless of the issue, but just how we had to really message things to open up a little bit of money and support to provide basic needs for people who needed care. And the other side of that is just seeing the way that communities really rally around folks that they relate to. So I can just remember very vividly for individuals, sort of in AIDS hospice houses and AIDS hospice situations, having people not related to them, but feeling very strongly about them and having care and compassion for them, spending hours at bedsides, and just seeing this and recognizing that this is happening all across the country and we're not really valuing it. And if we are, it's seen as charity as opposed to what it really is. And that is just basic dignity for who we are.
Sarah, you started to kind of approach it with that last bit of your comments, but we've kind of tiptoed around it this whole introduction, but there's clearly something broken in the system here. So what is it in particular? And it's such a multifaceted system, as we said at the get-go. but what is really keeping you two up at night when you think about the care economy and what needs to be approached first?
You want me to tackle that first, Megan?
Sure.
Sure, I'll start. So just to kind of follow up on my earlier comment, I think it's really about the inequities of the way that we approach the issue. And also the incredible lost opportunity that we have. And I think, Megan really pointed out in her opening comments from the former First Lady about the numbers that it impacts. But for me, it really says a lot about us that we are not investing in a sector or services that impact the most vulnerable among us. We at KU CPPR work a lot in childcare, and we can see that we all know the value that early learning spaces have for children and long-term impacts. And it really is an equity issue for me. And it speaks not so highly of us as a country that we don't invest in the way that we should. And so when I think about the lost opportunity and the inequity that underlies it, that's really the thing that keeps me up at night about this.
Absolutely. I think there's a lot that keeps me up at night, so it's hard to narrow it down. And certainly I think the equity piece and just the economic toll is huge and really can't be underestimated. I think at the human level, the thing that really bothers me the most is it's such a relatable issue when you think about just the number of people that have been a caregiver or thinking about it. I mean, I think if you go talk to anybody in your office or your neighborhood and say, hey, how many people do you know that are caring for a child or their parent or thinking about their parent as they get older or their grandparent or whoever it is? I mean, we all likely know at least one person. And so it's just very fascinating to me that it's this extremely human thing that most of us experience, but we still expect people to navigate it on their own, and we don't want to talk about it. It's I think our country is not great at talking about the hard things, and I think caregiving, there's a lot of joy and a lot of reward, but there's a lot of sadness and there's a lot of pain, and there's not quick answers to it. It can be a very long process for many families, and I think the idea that we allow the sheer number of people going through caregiving to just feel isolated is something that I really think we can do better with.
Okay, now I'm going to ask a really simple question, and that's fully sarcasm. Why do you think that is? What are all the root causes, as you see it, that are the reasonings behind why we don't talk about it, why we don't value it, why we don't address it in our economic policies and as businesses, and all the many things you touched on?
I think there's a lot of reasons, and I think there's certainly, I mean, each family and each culture is different. And so I think, in some families, it's very much an expectation that the care stays within the family, and bringing in outside help is just, it's not okay. In other families, that is not the situation. And so I don't want to make big sweeping statements because I think there's a lot of nuances. But I think one thing for me that it boils down to is I think our society craves these quick solutions, and caregiving is messy and it can be painful, and I think it's just hard to talk about because I think people don't really know the right questions to ask or how to support people, or there's a lot of well, they chose to do that, so that's their problem. And I think we do, in my work with caregivers, it would often be, oh my gosh, like what an amazing thing that you're doing for your family. And of course, there's a lot of joy and there's a lot of very positive experiences, but it can be equally rewarding and difficult. And I think we tend to try to put caregiving in a box, and it doesn't fit in one simple box. It's a complex issue.
I think another layer to that is a little bit of the culture that we have in the United States. I think caregiving is different in other countries across the world. For us specifically in the US, we really dramatized and even celebrated the divisions between the individual and public to really fit whatever narrative we believe in. We've seen this with the pandemic and even masking issues, right? It's my choice, it's my individual, and we're losing the public health element of the public side of the health element here. And we're missing the fact that we're social beings. Like, we are all interconnected, whether we want to think about it or not. None of us stays inside our home 24/7, 365 for our entire life. We interact with other people, and to not recognize the connections that those or the ripple effects that those connections have when it comes to our need for care, I think is really short-sighted and really a uniquely American trait, I would say.
Yeah, I know I've talked to you two about it, and some of the people on the call who probably recognize me know I love to always bring up kind of the individual versus community aspects of our culture and how so deeply ingrained that is, and how it feels like it's the root on so many of our issues in this country. So how do we begin to even start chipping away at this? What needs to be done first, in your opinions, or thought about first?
Something I think about a lot is language, and I think language matters a lot in this situation. And one of the reasons for that is a lot of people don't call themselves caregivers. They don't think of themselves as caregivers. They'll rattle off all of the different things they're doing to provide support for somebody, but then they'll say, yeah, but that's my job because I'm a mom, or I'm a brother, or whatever their familiar or friend role is. And it's interesting because there's research that has shown that people respond more positively to the act of caregiving rather than using the term caregiver for themselves. And I think there's something to that. But one thing that I find so fascinating is we've talked about, this impacts a huge number of people, but if people aren't calling themselves that, how do we really know? And then how do we know what the full level of need is? I personally think that we probably have pretty underestimated accounts of how many caregivers there truly are across the country. And then how do we begin to address it? And then how do we know if the interventions do anything? So I think finding ways to help people identify as caregivers, or whatever the term may be, is a good starting point. I think about just how do we normalize that word a little bit, because I do think there can be a bit of stigma around it. And even things like, we all go to the doctor's office, we get asked the same questions around like your substance use and your mental health and all of that. I mean, I think given the number of people that are providing care, maybe that's an opportunity to say, hey, are you a caregiver for somebody? How are you doing? Or just other ways that we're thinking about, we ask people about their dependents and their personal situations. How can we kind of thread caregiving into some of the questions we're already asking and get more people to use that word? Because I wonder how far we can go without finding some way to talk about caregiving consistently and measure it.
I think that from the economic side of things, I think having the common language is a really big step. And then I think we have to think outside the box on economic solutions to this as well, and think about the different actors or players who could play a role in even identifying what our data points might need to be and how we start to address those. So I think one of the untapped potential that we're seeing in our work in Kansas is the role of communities, and how communities are seeing like, okay, in my backyard, I have all of these various challenges and related to not having enough childcare or not having enough out of school after school care. I mean, the pandemic really made the invisible slightly more visible and really, I think, elevated the role of essential workers, at least in some of the public discourse, and the opportunity to bring other non-traditional community partners to the table to help solve it. So think about the role of employers and corporations. Megan talked about the language at the doctor's office, but you can also think about how employers can approach their employees as families, as caregivers, and think about offering different solutions. It's large, but paid family leave, not just maternity leave, but also paid sick leave for folks who maybe are caring for an older adult and taking the time that they need. We also could think about different community pools of resources. If we think about where care happens And we know that there are childcare settings and there are after school settings and there are elder care settings. And particularly in a community like I grew up in, a rural community, you may not have enough workforce to staff multiple different settings, but you could coordinate resources and perhaps staff one facility that thought about care across the lifespan. So I think it's kind of unhinging a little bit of not just care language overall, but even the sectors within the care economy, and start thinking about it as one long continuum and not just childcare is over here, out of school, after school care is over here, elderly care, disability care, but thinking about it as a continuum so that we can leverage the resources that are going to it, whether it be Medicaid or a payer, as well as workers who have a lot more in common than not when it comes to who is actually providing that care across the lifespan.
Yeah, I would like to add on to that. I 100% agree. And I think there's a huge opportunity for leaders across the sectors, excuse me, within the care economy to come together and recognize that, yes, there are differences. There are certainly nuances to providing childcare that are different when you're providing care for older adults, but there are a significant number of parallels. And there are also a many number of families that are providing care on both sides. There's a large number of people in the sandwich generation where they're caring for the older adults and children. And I truly think not only is it better for families who are trying to navigate not only one system, but sometimes multiple systems, it just makes sense to say, hey, there's some serious gaps across the board in terms of care. And how can we say, oh, that seems to be working really, really well in early childhood. What could maybe be done a little differently in home health care? We know workforce is a huge challenge across the board. Finding quality professionals and paying them a good amount to provide the care for our most vulnerable people, I think is a very common challenge that would be one opportunity to come together and say, how can we learn from each other and how could we try some things collectively?
Sarah, I love that reframing of kind of the continuum of care. Something that we see time and time again in these webinars, and I think I'll speak for my work, is that issue of communication and messaging and language, as it is so crucial, but is often one of the hardest pieces to address and change. Megan, you were talking at the beginning a little bit of this idea of it's really hard to measure, like what exactly is the depth of the problem. How do we go about solving it, and like what is making progress? And Sarah, you mentioned that that one case study of communities in Kansas. Are there other measures of success that you two can think of that we can look at, or in your wildest dreams, other ways we can go about measuring this and researching it to get progress?
I think one place to start is to look at what we're already doing. And there certainly is a lot of data being tracked around people receiving care, but oftentimes the caregiver is not factored into that. I think Medicaid is a great example. The client in that case is the individual receiving care. And there's not always a question being asked of what's happening with the caregiver, who is the caregiver? And so I think rather than reinvent the wheel, one opportunity is to say, we know that in many cases, there may be more than one caregiver. Like care rarely is a one-to-one situation. And so I think that's another piece to kind of reframe how we're thinking about, there are many families where there are potentially two or more parents providing care. There may be siblings providing care. I think really thinking about what is the full scope. There may be a primary caregiver in somebody's situation, but we know that oftentimes people talk about how it takes a village to raise a child. I think that's very true in terms of it takes a village to provide care at any age, and that's not always the case. But I think just starting with what data is already being asked within the care economy and how could we kind of either add on to it or further interrogate it to figure out, I think there may be more data that is available that there's an opportunity to look at a little differently.
Yeah, to pull that thread a little bit further, I think we've identified even census data and what do you ask on your tax return? And there are fields that we fill out. There are questions that we answer about dependence in certain ways. And I think you can extrapolate from that kind of information and note, if I have X amount of dependents under the age of 6, like I probably am providing care in specific ways, or I have a need for care in specific ways. I think there's also a way of just making sure that the data that's being collected is really getting at the heart of the issue, or pulling more consistent language. So one example would be, even in childcare, you can go into sort of the BLS data, and you can pull occupations, which will pull some childcare professionals, but a lot of children are being cared for in family childcare settings. And these are typically small business owners who are falling under a very different category in our national data sets. And that seems to me like a relatively simple fix of just acknowledging the nuances that live in the care sectors. And how can we ask those questions from an occupational standpoint on the same data collection processes and methods that we already put out? So to me, there seems to be some, if we just acknowledged the different roles that existed within the care economy, we could probably thread those kinds of questions into the data collection that already happens. And then I would also say the different organizations nationally that collect data across the lifespan, again, going back to that continuum. What does AARP collect? What does NACI collect? What are those different places that are already gathering information? Are they talking to one another? Are we able to kind of leverage those data sets and think about big data a little bit differently to get a sense of the who is providing care? And then I also think wage data, one of the big challenges that exist in the care economy, and Megan mentioned the number with a B in front of it early in the intro. And there is an opportunity, I think, to actually grow our economy if we invested a little bit more in the wages of the individuals who provide care. So if we can actually identify the who, and then we can start to make the argument that these are the amount of people that if they just made a little bit more, this is how much ROI, or return on investment, would actually come back into our economy, let alone the benefits that they would provide from a health and well-being standpoint. The economic argument to identify who is providing care and actually increase their wage to put money back into the economy is a really strong one.
I hope this isn't a controversial question, but I know so much of the national conversation around predominantly, I think, as it is right now at the forefront around childcare, is that families are spending so much money to get their children into childcare if they can, which often many people live in childcare deserts or can't find quality service. But on the flip side, as you have just been saying, caregivers aren't often making living wages. How do we remedy those two opposite ends? Like what is the solution there?
I think other payers into the system. We already have a mechanism to pay caregivers. It's called Medicaid or Medicare, and the mechanisms exist. We have to make some policy changes to open up billing codes. We have to think about care and define it a little bit differently, but there's a mechanism there. And then of course we have to have the not easy thing to do, but generate the public will to make that happen. And you asked the question about messaging earlier, Sophie, and I think change happens a lot of times from the ground up, and that it's about informing people, about giving them language to use. It's about communities demanding different ways of doing things. And the cynic in me says that there is an ROI here. Like it's the right thing to do. I think those of us on this call would recognize the social value and the social good in investing in caregiving, but there's also some really strong economic arguments to be made. And we have seen that laid bare with the pandemic. Workers cannot come to work. Absenteeism rates are really high. Women aren't coming back into the workforce. And so the economic argument, I think, is really strong to add more resources to the existing mechanisms that are there to flow resources and money into the pockets of those who provide care. These people are not going out and buying, yachts and fourth and fifth homes, luxury goods. They are putting money back into the economy. I think it's just a matter of, not just a matter of, but certainly figuring out how we speak that language, which I think a lot of times those of us in social services, there's a gap between the economic conversation and the social good. And if we can help those with resources see the economic value, I think there's a strong case to be made, and that's worth it.
Yeah, I absolutely echo everything Sarah said. And I think another payer that we don't talk about often enough, particularly on the other end of the care continuum, is private insurance. I think there's a massive opportunity to look at how can care be something that we look at like another health service, and how are we, I think as a country, we don't measure prevention very well. And certainly if we can support caregivers and give them a little respite care and give them a little break, that can pay for itself in the long run pretty quickly in terms of preventing somebody going into the facility earlier than they need to. And so I think looking at not only what is it, is it the right thing to do? I think there is a very significant economic case to be made for keeping people at home where most people want to be as long as possible. And just looking at the impact on not only on their health and their well-being, but just the caregiver health, because that is huge as well. We know there are many negative health consequences when caregivers do not get the support that they need. And I often describe becoming a caregiver as you wake up one day, or you often get a phone call in the middle of the night because something happened, and it's like you get handed a CEO title, but you don't get any training, and you probably don't get paid, and you don't get any time off. Oh, and you're not going to hire anybody, or if you want to hire somebody, you're going to pay significantly, and it's probably going to be really hard. Most of us wouldn't say that sounds like a really great job. Where do I sign? And so I think looking at it's a very reasonable thing for us to say, it's okay if you need a break. It doesn't make you a bad caregiver. It doesn't make you a bad parent. It's a very normal thing. We all understand. I think at least as we're improving some of the conversation around mental health, making sure that caregiving and the role of that and the toll that can take, being threaded into those conversations is really important. I think there's so many parallels between public health and just individual health and caregiving. And I think there's ways to look at how do we pull payers from those systems into the conversation, but how do we just think and talk about it a little differently?
So many great things you just said, Megan. I think anyone who's either giving care or watched someone they are close with give care can really see that toll and really empathize with that. Sarah, something you were both talking about, kind of the economic case and how we make that. Are there any adjacent examples of where we have, we as the collective, made a really successful case using that economic model for kind of a social good that you can think of that we could try and copy?
Economic models for social good. I think that this speaks a little bit to what Megan was saying about prevention, right? We're talking about, it's really hard to measure prevention. I think that the case has been made for recidivism. I think that some of this has been done there. I think, the housing first model speaks to how do we keep what they call frequent flyers out of emergency rooms, and we give them housing. That is the way to do it. But I think it's about, there's a little bit of a core issue here with how we define what is valuable to community well-being. And I really do think this is at a community level. I really think communities have to drive this. I'm not sure that state and federal levels can be the drivers. I think they have to be the resource, but I think communities have to demand this. They have to look around and see that their communities are better off when children in their community are in childcare settings, or parents have the option for affordable and accessible childcare, when children are in proper out of school, after school places. when elderly adults in the community are supported with the resources that they need. So I do think communities have taken the lead on some of these issues, and I would look to local solutions. We also, I think the housing industry has done some really good work around the benefits of supportive housing. And so I think that's, kind of going back to what I said earlier, that's a model. But the return on investment is, we don't do enough to calculate it. So I think that's really on us to do a better job of really identifying the cost savings to society, and also the benefits to having aging in place, and to having high quality childcare settings when it comes to especially issues of equity.
Yeah, the housing model is near and dear to my heart and something I think about a lot. So what are, and I think you were hinting at some things there, Sarah, what are some things that, I'll switch this. I'll start with the pessimistic one. What are some things that you're seeing emerging that are giving pause, making you a little pessimistic about this? And everyone, don't worry, I'll ask what is also asking, or what is making everyone optimistic. So we want to end it on a sad note.
I think that I really worry about the inequities only growing in a lot of different places. I'm going to go ahead and take the optimistic a little bit, if you don't mind, Sophie. I certainly don't think it can replace the human element, but I think there is a lot that technology can help with. And I think there's some exciting things being explored, particularly for aging in place and older adults, and maintaining dignity and independence, and what I think most of us want for our future selves. But with things like that, I think about, how affordable is that? How accessible is that? Is that something that's more accessible in urban areas? I think I worry that if we don't change the conversation pretty significantly, it's just going to, the divide is going to continue to grow. And certainly that's not to say there are plenty of caregivers that have quite a bit of money. That does not make it easy or accessible. It is not just a cost issue, but certainly money helps. And we need to come up with solutions that are truly accessible for all people, regardless of their circumstances.
Yeah, I would just echo on the pessimistic side of things, the potential inequities that exist. I mean, the growth of technology, big data, how are those things going to be helping communities with resources, and hurting those, and further, creating this divide we already have in our country. I think another thing that makes me a little bit pessimistic is what I would say is the result of what we've seen in the masking conversation. I mean, the idea that my health is only mine and my business, and what I do doesn't impact you, is really troubling, I would say. And I think that goes back to needing to change the dialogue about how we are all interconnected. And regardless of what messaging approach you take, economic, social good, do the right thing, ROI, I think you have to figure out what is the right message for the right audience that's going to sort of create this shared understanding that these things are public health issues, and that public health means we are all part of it, and we're all part of the public. From an optimistic side of things, I think the pandemic has made us rethink what work is and looks like, specifically the workplace, right? So I think Megan mentioned this in an earlier conversation we were having, is we've all seen the little people on Zooms that have cropped up into our lives for those of us who have been fortunate enough to be able to work from home during the pandemic. And so it's kind of breaking down those barriers of, oh, this person isn't just an employer or an employee producing value to me. They are also a parent, and they have their, a teacher, and they're having caregiving responsibilities at home. So it's kind of blurred those lines, which I think strengthens the conversation and strengthens the narrative that people are wearing multiple hats, and caregiving is absolutely one of them. The final thing I would note is is I think there's a change in the way we value labor, potentially. The news out of unionizing at Amazon, at Starbucks, I think it's an interesting trend to potentially look at. Are labor unions making a resurgence? And is that an opportunity for caregivers? Again, break down those silos. You're not just childcare versus, there's no versus, it's you're all on the same team. How can we think about that? And mobilize people to really stand up for themselves and identify as a caregiver and speak a little bit more globally with one voice, to hopefully make change.
So I know we are approaching, and Diego had put in the chat, our Q&A time, and I know Sarah and Megan, we've talked about this. We are barely scratching the surface of this issue and how we can go about solving it. But I did just want to kind of open the floor to the two of you. If there are any other points that you feel like you weren't able to speak to, or thoughts that came to you as we were talking through this, just want to open the floor for any of that.
I think to add to kind of what makes me optimistic and curious to see how this unfolds is I think the pandemic helped with normalizing that it's okay to need help and to not be okay. And I think that certainly extends to caregiving. I think we saw instances of parents saying, oh my gosh, I didn't realize other people were struggling as much as I was, or I can't do this. And I think there are very real and perceived fears around saying when you're a caregiver that like, I'm struggling and I need help. I think there can be some actual punitive actions to that in certain situations. And so I think breaking down that stigma, it makes me optimistic because I think it's a really positive thing. And I think people deserve to be able to say, I need to tap out periodically and I want to ensure that somebody is being cared for so that I can go to work or so that I can just take a break. That's something we can all relate to. And I'm sensing from individuals and communities that there's a little bit of this growing enough is enough feeling. And I think I have some faith in enough people raising the flag on this issue and saying, we can do better than this. I think for me, when I got sick and I navigated the system, honestly, it was pretty shocking. I mean, growing up in the United States in a very privileged setting, it was eye-opening to say, wow, this is really hard and I have a lot of privilege and access. And I think more and more people are starting to recognize that that is true. And there are some pretty gaping holes across our systems. And so how can we work collectively to not just accept this and to do better? So that makes me optimistic. I also think about, if for no other reason, people should think about, what do you want for yourself? What do you want for your family? I know I'm in my 30s and I talk to my friends about what they want for their future and their parents as they're getting older, like it's a little different conversation. And I think many of us grew up with grandparents that were in facilities, and it's like, maybe you had a positive experience and maybe you didn't, and maybe that's not what you want for yourself. And so the good news is I think a lot of us have some time and some opportunity to push back on that a little bit, and some of the things that we've seen, and say, what can we do now to make a better future for our families and for ourselves and our communities.
I would also just want to leave the conversation with this idea that change can start small. That, we talk about big payers and we talk about big systemic challenges, but there are little things that can be done. There are small actionable steps that we take. We're not going to be able to solve this overnight, but slowly chipping away. I think having conversations, finding shared language, identifying how to break down those care sector silos, those can be done at local levels. You don't need the state to intervene or the federal government to intervene to do those kinds of things. If you just sort of asking and normalizing the conversation around caregiving is one thing that people can do today that actually can start to push the boulder slowly to break down that stigma. And, I think we are seeing, again, I go back to the community level response, and for employers and corporations to really think about, how can I support my employees? caregiving will come up. I guarantee you, if folks just ask that question about how can I support those who provide value to me as an employer. So I do think there are little things that can be done, the normalizing the conversation, identifying shared language, having the conversations at a local level, and also just trying to break down those stigmas. Solutions will come out of those. People will find momentum, because to Megan's point, it is something that is going to impact all of us. And think about what your future self is going to want and need. And that is something we can all relate to.
I love that. I think in addition to the economic model, maybe we can all make a selfish call for people to care in their own personal interest if that social moral good one doesn't. So we're at time for opening up to Q&A. If anyone wants to either unmute or put something in the chat, feel free. But I will lead us off / wrap us up with one of my favorite questions, which is and I stole this from Ezra Klein, what is a book or a resource you would recommend? And it doesn't have to necessarily be related to this topic, but just something you would recommend.
I can go. So I'm reading a book right now, full disclosure, I haven't finished it, but I still feel good about making the recommendation. It's called The Lady's Handbook for Her Mysterious Illness. It's by Sarah Ramey, and I'm really enjoying it. It's oddly light and funny, even though it's a very serious subject. But I would recommend it because I think it talks about the number of people that have to navigate some sort of unexplainable medical situation. And I think a lot of us know somebody who is like, something's wrong, but the doctor I can't figure out what it is. And it's an amusing but very, very relatable story about just navigating the healthcare system and what that can do for individuals and their families and the toll that can take, but also the hope that can come with that. So I would recommend it. Again, it's called The Lady's Handbook for Her Mysterious Illness by Sarah Ramey.
I should have went first because I think my book recommendation is a little more boring and dull and a bit of a thicker read, but I'm also, full disclosure, not finished with it, but it's The Value of Everything, Making and Taking in a Global Economy by Mariana Mazzucato, who is a forward thinker on a new way of thinking about wealth and the global economy. She's a really good thinker, but it's a challenging look at how we think about value. And I kind of mentioned this before, unhinging what we mean is valuable to our society. She offers a lot of insights into the history of the value conversation and how in our modern economic policy, we've drifted into more like technical terms like, oh, you're an economist, so you speak in a very different language. And early stages of economic thought were all driven by the social context that was around us, and value is a core element to that concept. And I think it helps us just rethink what value means as a societal benefit and not just X's and O's, that money has real impact on our social well-being, and they should not be split apart. They should be thought of as together. And her book does a really good job of laying the history of that out and even some things that we can do to help change the conversation.
Thank you for both of those. And if you finish them and decide they're bad, you're going to have to send a mass email to everyone to let us know. I'm going to jump back in the chat a little bit. Lauren put a great question. How do you think the predatory nature of privatized retirement homes has an impact on the care economy of the elderly in this country? And what are potential solutions?
Lauren, that is
a simple one.
A light question. Yeah, that's a big question. And I am certainly not going to claim that I have all the answers on that one. I think that's a very real concern, and I appreciate you raising it. I mean, I think this might be an overly simple answer, but I would just say, I genuinely believe there are financial opportunities with the care economy. And I think with that, unfortunately, there are going to be people that want to take advantage of it. and maximize on it. And we need to be aware of that going in. I think go in eyes wide open, but also make a real case for here's a way to do this in a way that is not taking advantage of people. I truly believe that we can find a way to provide quality care, pay people who are providing quality care at least living wages, and ensure that people's health and dignity is maintained in the process, while also potentially, yes, having people make money. So I think just getting ahead of that conversation and being open to that conversation. I think sometimes there can be a fear of the private sector getting involved with the care economy. And I think there are reasons for that. And certainly there are bad examples, but I think there are also good examples. And so finding ways to highlight, there are many cases of private companies doing great things within the care economy. And so celebrating that and not being afraid of the money conversation, because I think we need all the people involved in this conversation we can get, and they may look a little less traditional than the way we've been approaching this issue.
Sophie, if I might add to that, this is a real fear in the childcare conversation as more and more, when Build Back Better was sort of potentially coming down, people were seeing the dollar signs coming into childcare, and you saw a little bit of like private equity coming into the childcare space. And there's a fear there around like sort of the same model that you're talking about in your question about sort of predatory practices. And I think one of the big things we can do to hedge against that, at least on the childcare side, is improve wages. We are and have higher wages for those who are doing the work so that they can stay in business. There are a lot of really high quality professionals who are family childcare providers in particular, who are not taking a salary at all. And we need more of the people who are providing those kinds of high quality services. We need to pay them what they're worth, and hopefully recruit more folks like that.
That makes me feel a little optimistic. Jackie also put in the chat, what are your thoughts around gender roles in caregiving? Any opportunities or good examples of when it is more equitably distributed?
Jackie with the stumper question. I think the data tells us that it's primarily women who are in caregiving roles, and that our economy suffers especially with COVID, that women are forced to make sort of untenable choices about staying in the workforce or wearing that traditional caregiving hat. I do think that there are opportunities for women to be more entrepreneurial. Caregiving can offer some opportunities for that to support women in the workforce. So my thoughts on gender roles are that we need a little bit more of a fair approach to things, to make sure that women are supported in having all the choices available to them, and not being embracing the conversation around men as caregivers, taking away of a little bit of the traditional gender stereotype. So that's what I would say about kind of my thoughts on gender roles there.
I agree. I do think, I mean, the data does consistently show there are more women caregivers, but I don't think we talk enough about male caregivers, or people who don't identify as women. And I think that's a really important place to start, and ensuring that not only are we talking about it more, but we're not unintentionally making anybody who doesn't identify as a woman feel like I can't be a part of this conversation, or I don't see myself in this role. I think change, to use Sarah's words, change can start at a small level, and recognizing all of the caregivers in your life and calling them that, and saying, you know, my hope would be as people leave this call that they might say, wow, I didn't realize somebody in my life was doing that. Pick up the phone and acknowledge that. They may not call themselves a caregiver, but I think there's a lot more people in your lives than you realize that are taking on this role. And I go back to that language matters. And I think that's definitely true in gender, and ensuring that we're being equitable as we think about solutions and resources and places to start the conversation with everybody impacted by this issue.
This is just a small example, but when I was working in housing for individuals with HIV and AIDS, I would say that the LGBTQ IA community does a great job of thinking about, of sort of eliminating gender role from caregiving and kind of just noting that who needs care and who's available to provide that care. I think a lot of that, unfortunately, was born out of necessity with sort of the strong stigma of that came and still exists with HIV and AIDS. But I think that's a good example of noting just the deeply rooted sense that we have as humans to care for others, and embracing that and offer opportunities to embrace that outside of the traditional gender roles that society has kind of layered over the top. And so how do we kind of get back to those basic sense of just what it means to care and have compassion and have empathy for those that are in our community, whether they are loved ones or not loved ones, whether they are family or not family, I think helps, again, just break those traditional bonds a little bit down.
Thank you for that great question, Jackie. I see we are almost at time for our session today, but unless there are any other questions, I will hand it back to Diego. Thank you, Sarah and Megan, so much. I hope everyone's head feels as full of thoughts and ideas as mine.